Now coming to the clinical manifestations of rotaviral infection. So we will write here the clinical manifestation. So manifestations are from subclinical to severe gastroenteritis to life-threatening dehydration. Incubation period of this rotaviral infection ranges from 1 to 3 days. Okay. Abrupt onset of vomiting, diarrhea and fever more than 39 degrees centigrade. Those are the clinical features. So abrupt onset of vomiting, diarrhea and fever more than 39 degrees centigrade, and most importantly, passing of watery stool. That usually resolves within 3 to 7 days. So watery stool is common. Now coming to the immunity of rotaviral infection. So rotavirus, immunity of rotaviral infection. Rotaviral infection. So the basic thing we have to know now. Rotavirus infect and destroy mature enterocytes in the villus epithelium of proximal small intestine. So some things, important things are there. So rotaviral will infect and destroy. So we will write over here rotavirus infect, rotaviruses infect plus destroy what? Mature enterocytes. These mature enterocytes are important. In the villus epithelium, VILLOUS, villus epithelium of proximal small intestine. So proximal is important, small intestine is important. Okay. So what is the reason behind this watery stool, watery diarrhea? There are many reasons. We'll have to know the reason behind the watery stool. Passing of watery stool and watery diarrhea. Coming on. So, watery stool. We will write the reasons one by one. Number 1. So as they infect and destroy mature enterocytes in the villus epithelium of proximal small intestine, so the loss of absorptive villus epithelium. Number 1 cause is the loss of absorptive villus epithelium. The loss of absorptive villus epithelium. Number 2, proliferation of secretory Krebs cells. That will cause secretory diarrhea. So there is proliferation of secretory Krebs cells will cause secretory diarrhea. Number 3, brush border enzyme characterized cells are reduced. So brush border enzyme characterized cells are reduced. These changes lead to accumulation of unmetabolized disaccharides. These 3 changes actually lead to accumulation of disaccharides but unmetabolized. That causes osmotic diarrhea. Okay. Number 4 is there. Non-structural rotaviral proteins are there. Those are called non-structural rotavirus protein. NSP4. Non-structural rotaviral proteins. Okay. They function as an enterotoxin. So, functions as an enterotoxin. Contributes to secretory diarrhea by altering epithelial cell function and permeability. These enterotoxins contributes to secretory diarrhea by altering epithelial cell function and permeability. Each and every word is important. Okay, so 4 causes we have already read. What is the 5th one? It is rotavirus activates enteric nervous system in the intestinal wall. So rotavirus activates enteric nervous system in the intestinal wall that evoke fluid secretion. So often in examination and as well as in viva, the question comes as, so rotavirus diarrhea is a type of watery diarrhea or secretory diarrhea. Justify, or what are the reasons behind this watery secretion or watery stool? So 5 points are there. All the points are important. Okay, the first point is the loss of absorptive villus epithelium. As we already discussed, that rotavirus infect plus destroy mature enterocytes in the villus epithelium of proximal small intestine. So destroy mature enterocytes. So loss of absorptive villus epithelium. Next, the proliferation of secretory Krebs cells. So proliferation causes secretion, so ultimately causes secretory diarrhea. Then brush border enzyme characterized cells are reduced. So enzyme characterized cells are reduced, that means the disaccharides which the patient ingests, so those are unmetabolized. so lead to accumulation of unmetabolized disaccharide. We all know that they will draw water, ultimately osmotic diarrhea is there. And number 4 is NSP4, that is non-structural rotaviral proteins are there. So NSP4 functions as an enterotoxin that contributes to secretory diarrhea by altering epithelial cell function and permeability. Fifth is rotaviral activates enteric nervous system in the intestinal wall. So whenever activation is there, there is secretion of fluid, so that evoke fluid secretion. Okay, so those are the causes behind the watery stool.